A special report from News Channel 9. I'm Jeff Kulikowski. The County Executive Ryan McMahon about to walk up to the podium to give his daily briefing on the COVID-19 situation here in Onondaga County. At last count, as of Sunday, 364 people in our community have tested positive for COVID-19. That was up 15 from Saturday. We'll have to see which way that curve is going, if we've gotten near to the top of the apex or if we're still going up. Here's the county executive.
Initiatives that I'm asking the community to buy into on a voluntary basis so we can flatten our curve and kill this virus. We currently have 377 cases. That's up from 364 yesterday, or 13 more cases. That number is better than yesterday's new cases, which was better from the day before. 29 individuals are in the hospital. 17 of them are in critical condition. A reminder on the hospital reporting each day, I'm reporting on the Onondaga County cases in the hospital. Our hospitals in our region support all of central and northern New York. There's certainly other cases related to COVID-19 from other counties in our hospital. And when you look at really our central New York and northern New York counties, we have a graph over here to my left, the shaded red counties. There's now over 1,060 combined COVID-19 cases in there. We track this. Why do we track this? Because we know at some point those cases will utilize their local infrastructure, which is not as robust as ours, and eventually they will use our hospitals as a backstop as we fight this virus together. Today there are 115 who have recovered and are released from mandatory isolation. So when we look at our numbers, our two curves, 377 positive cases, and we're presently monitoring 257 active cases. We only had one come off of active from yesterday, but certainly 13 positives is going in the right direction when we look at the last week. Hopefully we'll continue to see that trend. 41 individuals out of our 377 are household contacts. Again, what we're seeing is that once we have positive cases, between 10 and 12% of those positive cases will drive contact cases. So out of our number here, we're looking at what, 336 cases. Those 336 cases turn into 41 household members who get it. We have a total of 377 cases. 199 cases are female, 178 cases are male. 11 are under 19 years of age, 83 cases in their 20s, 59 in their 30s, 53 in their 40s, 72 cases in their 50s, 54 cases in their 60s, 30 cases in their 70s, 13 cases in their 80s, and 2 cases in their 90s. Breakdown by percentages. A lot of people like these. They haven't changed much, but we'll go over them again. 25% of our cases are under 30. 41% are under 40. 55% under 50. 74% are under 60. And 26% of our cases are over 60 years of age. Breakdown by municipality. City of Syracuse, 137. Town of Clay, 40. Town of DeWitt, 28. Camillus, 24. Town of Cicero, 23. Town of Salina, 23. Town of Manlius, 19. Town of Onondaga, 19. Town of Pompey, 15. Town of Geddes, 13. Town of Lysander, 11. Town of Skaneateles, 8. Town of Van Buren, 4. Town of Lafayette, 3. Town of Marcellus, 3. Town of Atisco, 3. Town of Tully, 2. Town of Fabius, 1. And Town of Spafford, 1. What does this tell us? Every town, with the exception of the town of Elbridge, has a positive case that's been tested. And the Onondaga Nation, who we're also working with, has no positive cases at this point. So it's everywhere in our county. It's north, it's south, it's east and it's west. We have community spread. Testing, there are 5,381 tests that have been administered. 4,970 tests have been returned, with 377 positive and 4,593 negatives. We have 411 pending tests. Not all those tests will be for county residents. Essentially 15 to 20% of the testing that's been done is for residents outside our community that come in and use our doctors, our hospitals, and our triage site. We received 98 tests back since yesterday. Right now, testing, we've been saying it's 24 to 48 hours at our triage site. It's now safer to say it's 48 to 72 hour turn time on average. 7.5% of those being tested are positive. We've seen that to be the new real benchmark. That means that essentially you have 93% of folks that have symptoms are sick with something else. And I know there's been a lot of folks and a lot of people sending us emails, asking the questions, suggesting that the COVID-19 was here a long time ago. We were testing before we had positive cases of COVID-19 for about a week and a half. We didn't see any until we reported we saw some. But what we knew is we had a lot of respiratory illness that was similar to it, and you had to rule it out. That's why we made a lot of decisions we made early on, because with any respiratory illness, you have to rule out COVID-19. So still, to date, roughly 93% of people getting tested, they're sick or they're not getting tested, still have something else that's not COVID-19. Think about that. Positive tests. After a positive test, our health department's going to contact you, check in on your health, look at what your direct contacts have been. You should also hear from your primary care provider. In addition to that, through our investigation, we will know which people to contact to go into a quarantine situation. Anyone who has been tested must stay in a quarantine until you get your test results back. Again, something that we did very early on in this process to help isolate potential risk to the system and to the community. If you were testing for COVID-19, you were sick with something, so we don't want you spreading that, and that's still the case today. Gaps in the investigation, we've talked about this. You will hear from us when there is a gap in our investigation, meaning we are not 100% sure if we got to everybody. We need the public's help to really be aware if they were in that business, to monitor their symptoms, if they have symptoms, to talk to their doctor. If you don't hear from us and you hear from an employer, that means we are confident within our own investigation that we have quarantined everyone that should be quarantined, and the employer is doing what they should be doing. They're letting their workforce know that there was somebody at the workplace that tested positive. Just because you work with somebody in the same building doesn't mean you had a direct contact with them. So saying that, I do want to highlight these 4 businesses where we asked the public for help over the last 24 hours again. Walgreens, 4001 South Salina Street, Syracuse, in the Valley. On March 27th, 7:50 a.m. to 4:40 p.m. March 28th, 7:30 a.m. to 5:45 p.m. March 30th, 7:50 a.m. to 5:10 p.m. March 31st, 1 p.m. to 9:15 p.m. If you shopped at Walgreens, this is over a week ago, during these times, please monitor your symptoms. We have community spread. We should be doing this anyways, but now we know that there was an employee there that tested positive. Please monitor your symptoms if you're shopping there. Walgreens at 4751 Onondaga Boulevard. This is my Walgreens. March 27th, 2020, 1 to 9 p.m. March 28th, 1 to 9 p.m. March 30th, 1 to 8 p.m. and March 31st, 1 to 3 p.m. If you were in that Walgreens during that period of time, we are not suggesting you had direct contact. What we're saying is watch your symptoms, and if you become symptomatic, please call your doctor. Okay? Kinney Drugs, 437 Electronics Parkway, Liverpool, New York. March 27th, 7 a.m. to 3 p.m. March 29th, 5 a.m. to 11 a.m. Same thing. If you went shopping there, please monitor your symptoms. We're not suggesting you need to panic because you were in the same building as someone, but we want you to monitor your symptoms just like we want everybody to at this point. Hale & Ann's Wine and Liquor, 3504 West Genesee Street. March 30th, 9 a.m. to 5 p.m. and March 31st, 9 a.m. to 5 p.m. If you're at the liquor store during those times, please monitor your symptoms and reach out to your doctor if you have any symptoms. Okay? Positive cases. Let's talk about home isolation release. We're going through this. People are recovering. That's very good. There's a process where we need our positives to work with us and follow the process. We know you're anxious. We know you're excited. Thank you. You guys have been great in this process. It's scary, and we're so happy that you're recovering. That's why we've started an expedited process online. It's a password-protected application process for those who are recovering that can input all of their information regarding their health status. All the data is reviewed by our staff to ensure accuracy. Please answer any text messages with communication on changes in your conditions with our health department. Thank you, everybody who are utilizing technology through this for us. The end of this process hasn't changed. We, the health department, Dr. Gupta and her team, need to sign off on the health release, and that's important. If you don't get that signed off on, you are still in mandatory isolation, and that's very important. Also, during this process, let's keep our cool. It's tough these days to keep our cool. No yelling at our health department. Okay? Plasma Project, upstate. Very thankful for everybody that's volunteered. We have more people who've reached out to us that had similar ailments, different periods of time during the course of this process, wondering if they had COVID-19, asked if they can take part in this. I don't know the answer to that, so I've referred them to this. But thank you for that type of spirit in the community, trying to figure out ways they can do our part. Well over 100 people have reached out and volunteered. That's fantastic. All right, folks, social distancing. I am pleading with you as a community. We are starting to see some data this week that shows a little bit of hope, and that's the good news. The bad news is the cases that we have seen of recent demonstrate behavior that was avoidable. And that is more quarantines and more positives because of avoidable behavior. The data of recent from independent monitoring sources show our social distancing as graded getting worse. Let me show you, not that one, but where is the other one? Well, apparently it's not there. But let me show you what our goal needs to be on social distancing. I'm going to hold this up because I get this. There's two curves. This is an algorithm from Upstate Medical University. We are really right in this area, okay? We are projected to go either on this brown curve, if we get to 38% social distancing, where we're not there yet, or we can get to 50 and go on the yellow curve, okay? The yellow curve is very manageable, and it will give us a very good argument to make to opening up non-essential businesses and getting back to work and getting our lives back. So what do we got to do to get there? Our data shows that 2 weeks ago, based off of mobile cell phone data, we were graded as a B. Now we're at a C- today, a week later. We need to get to 50%. So I'm asking for your help and getting there. And so we talked about yesterday about the voluntary shelter in place. I do not have the legal authority to do a shelter in place. The governor of the state of New York does. So those of you who are emailing me and yelling at me because I have not gone far enough, I apologize, but I don't have that ability. Those of you who are yelling at me saying I've gone too far, I apologize, but we have to get to 50% social distancing, and this is voluntary. So what does it look like? We are asking for a 2-week shelter in place, voluntary, meaning we're changing just our consumer behavior when we leave the house. Okay, so you go out and shop or use public parks on certain days of the week based off of the year you were born. What if you and your spouse were born in different years? Okay, just let's pretend that you're born in the same year and you both go out together and you utilize the shopping and or taking a walk in a park that time. It's probably smart for you not to go shopping together, but certainly that it would be our recommendation in that process. So we have our two charts kind of explaining what we're asking you to do. Even birthday years, that would be myself. Tuesday, Thursday, Saturday, Sunday, April 19th. What are we asking you to do? If you need to go to the grocery store, if you need to go to the pharmacy, you got to go to Home Depot, please go on one of these days. If you want to go to a park, the parks are closed, but the governments have kept them open so people can go and take a walk and still deal with the mental health aspect of this. So please do that. If you were born in an odd year, we're asking Monday, Wednesday, Friday, Sunday, April 12th to go do your shopping on those dates. We believe if we can do this and modify our behavior for 2 weeks, we'll get ourselves to that 50% social distancing. That will help us when we're identifying positive through testing, we're quarantining, and then we're starving out the virus. We can't do this alone. We need your help. So please do this on a voluntary basis. I've had people say, well, what if I got to go shop in certain times. I'm a senior. If I go early on this day, I can get my groceries. Okay, that's fine. This is all voluntary. If it doesn't meet a need, we still ask you to really look at social distancing. And we're not suggesting that you should go out shopping all 3 or 4 of these days, but we ask that if everybody just did that and they went shopping just on those days, we would thin everything out. The density would get thinned out. And that's been a challenge, as everybody knows, at a lot of our retail establishments. So I'm pleading with you to work with us on this. Certainly, we look at data, we look at cases, we look at how many cases have different types of affiliations with different types of social behavior, and then we respond. I don't get specifics on this case was at this person at this time, but we're utilizing data to drive the decisions. That's where we came up with the decision as well to shut down golf courses for a brief period of time in April, when normally in April we are still shoveling snow. And so we need everybody's buy-in. Certainly many golfers don't do anything wrong and they practice social distancing, and that's the majority. And I apologize for the inconvenience, mostly to the business owners, secondarily to the golfers. But we need you to buy in. We need you to lead now too. I need your help. So those are two really key things we wanted to highlight. We're assessing parks day in and day out. We have in our parks are essentially closed, but we have our park rangers monitoring the parking lots for traffic and then monitoring the parks. If it becomes an issue where social distancing is not being abided by in our parks, we're going to have tough decisions to make. So I'm asking for the public to work with us on this. Okay? Looking at this, voluntarily shelter in place, we just went through all that. Let's talk about masks. I have my mask. We are recommending to the public that you wear a mask when you're going out and you're going to be around other people. In other countries, this has worked. There's no reason not to do it. Again, Belinda made me this mask. She can't make a mask for all of you, but you got to find your own Belinda, and they'll help you with your masks. So Belinda, again, thank you. But this is something that the CDC is recommending. Let's buy into this. Let's get through this for the next 2 weeks, 3 weeks. But I think we're seeing data where if we hunker down for 2 weeks, we're going to put ourselves in a position for success. A couple lines, and then I'll take questions. Upstate Triage Hotline, 315-464-3979. Call that number if you don't have health insurance to get screened for testing for COVID-19. Our seniors, our healthcare workers, and adult nutrition hotline, 315-218-1987. I want to thank all of our volunteers out delivering meals to individuals that have never been in this position before, where they need help, they need meals, they need groceries, they need toiletries. We've had such a great response from our workforce and our volunteers on this, so thank you so much. Childcare Solutions, our daycare program for essential businesses. Each day we get different people calling about this. This is a great program. The number is 315-446-1220. If you have yourself in a bind for daycare, and or you need for 1 day or 2 days or the month of April, we have slots for you free of charge. So please take advantage of that. Let's not use grandma and grandpa's daycare. It's not a good idea. We've been saying this the whole time. If you're an essential business person, let's avoid that and let's use our program. Donations of PPE, 315-435-2525. Thank you for everybody doing their part. PPE is going to be a challenge throughout this process, both at the federal, state, and local level. We're all trying to keep our medical professionals, emergency responders, employees with protective gear so that they are safe from COVID-19. So I want to thank people who've donated that. And always, mental health is a serious issue. Please contact 211 if you need to talk to somebody. It's not getting easier as we ask you for more sacrifice and we ask to change behavior. I get it. My email's been one way. You've all been venting today. But if other people need to reach out to professionals to get through this, get through strategies, please contact 211. Questions?
Brian, in 2 weeks, how will we know whether we've succeeded?
I think what we'll know, hopefully in 1 week, Tim, we'll see some of the success with the mobile data, and we'll see testing demand start to go down. We had a good day yesterday. Testing demand went back under 100. So that's one good day. But technology is amazing, and they can track in GIS code density at different spots. So we're looking at that. We have these independent validators, and we can do different GIS tracking and where you can see density and whether it's thermal through heat sensory or whatnot. So we're looking at all of this. This is what's driving decisions. I know people question, you just make these decisions by yourself when you're up at night? The answer is no. We're looking at data. It's driving decisions. We are not making a decision to shut down any aspect of recreational life unless it was a problem. You saw the city of Syracuse have a problem a week ago with basketball courts, right? What do? Do you go around and you try to police a bunch of kids? And what happens when you have to police the kids? It's not going to be good, right? So what do? You took the hoops. You see a lot of some density-related problems out in golf courses. What do? You try to go police a bunch of grown men? You're probably not going to end up well, right? So we ask for some sacrifice to get us through this period of time where really we can push our curve and flatten it, or we can continue to not recognize this as a real threat in our community and continue to let it spread. And then that does the reverse impact. If this continues to go like that and doesn't flatten out, then businesses are going to be out of business longer. And you're not going to end up being able to do the recreational things you want to do longer. So we've always tried to be a little bit ahead of the curve in some of the things we're doing. I talked to county leaders today from other counties. They're going to implement similar requests and orders of their community related to commercial spending in public parks. So we're trying to get ahead of the curve here and really flatten this thing out. I'm desperate to get back to business. And this is how we need everybody's help.
Some other counties are going to model this?
Yeah, I got feedback from at least 2 other counties today, so I'm not going to leak who they are because they're probably going to want to do their own announcements. But I think in short term, you'll see that. And certainly the golf course order is one that county executives have been talking about for a long time. So I think you'll see that in other counties as well. Because most people are doing the right thing, but it doesn't. Most people, every kid who's shooting baskets in a park by himself is doing okay. It's when there's 50 kids there that it becomes a problem.
You've mentioned a lot of these recent cases being avoidable. Where specifically have these people been to be exposed to the virus that they shouldn't have been?
Yeah, so I can't talk, Andrew, about specifics because I don't get the specific cases, nor would I talk about the very specifics. But what I can tell you is that these are social type contacts, and judging by some of those investigations and some of the affiliations and the painful quarantines that we have to go monitor, It's never really the sick person that's the problem, right? They're sick. They want your help. It's the people in a quarantine that don't think they should be in one that becomes a problem. And so when people are out doing things they don't have to do, and they're out hanging out with people that aren't their immediate family in any venue, you present an opportunity for the virus to jump from one host to another. And that has happened. And even if you were in that area, if you were hanging out with 4 or 5 of your friends, and you shouldn't be, even if you didn't get it, for now you're in a 14-day quarantine, and certainly some people are handling that process better than others. And if you don't handle it well, we have to monitor it and have resources monitoring you. And if you don't respond to our health department, our law enforcement has to go then and monitor it. This is something that we don't want. So to avoid all of this, just let's social distance. Let's stay home. Let's tough it out.
Are they parties? Is there any golf course positive cases that
Yeah,
you
we're
can
not
connect
going to
back
talk
to?
specifically
Even
about
the categories.
So I would say social gatherings is a broad category. We can try to connect dots here with the way things are happening. I'll let people connect the dots, but there's social gatherings where people are getting together, and nobody's trying to spread COVID-19. But the reality of this virus is lethal, it is active and aggressive, and if you don't want to get this, and you don't want someone you know who has a compromised immune system getting this, or else things can get really real really quick. So we're not suggesting anybody wants to spread this. We're saying we know it. People have gone to work sick. We know it. We talked about it, okay? That should never happen, okay? But we also know, based off of cases, that in some cases, the social behavior, people just weren't buying in. So we need you to buy in now. We're begging you to buy in.
So, to clarify, you have been in contact with other counties in talks to shut down golf courses, because right now, someone from our county could easily go to a nearby county and golf.
Yeah, they could. Nobody's going to be golfing when it's snowing later this week. So, but it's not my job to tell other counties what to do. I know through this process, one of the frustrations was that various parks-related or recreational-related activity presents opportunities for the virus to spread to new hosts. We have done and made very difficult decisions throughout this process. We shut down a parade before we had a positive case, a very popular parade. I'm very Irish, okay? We closed a mall, the 6th largest shopping center in the country, because of the opportunity for this to spread. We've made difficult decisions every step of the way, but it's all been based off of data and risk management and risk mitigation. So as this process goes on, once we're into it, we have to have short-term pain for long-term gain now. And we're asking people just to hunker in for 2 weeks. Change your behavior a little bit. That's all. The reality, when you put things into perspective, what we're asking is not a big sacrifice.
In terms of data guiding the decision on golf courses, let's say grocery stores and parks based on the shelter in place, were there any positive cases connected to people gathering in any of those category of places, or is it more based on the cell phone data that indicates people were gathering in groups with or without a positive test?
You are asking the same question a different way, Andrew. I'm used to this by now. So my answer is people can come to their own conclusions on the social gatherings, but certainly the cell phone data and different GIS data makes a strong argument for us as well at different locations throughout the county when we look at the decisions we've made.
Ryan, is that data something you're able to look at directly, or are you looking at?
Yeah, some of it's independent, Tim. I think the one, our one grade that we get from the one outlet there, I continue to monitor. We have a GIS team that that tries to work on other things for us, and there's other models too where you can plug into various sensory mapping anywhere in the country on any date, and those are really interesting. When they really did that for spring breakers. During the spring break. So there's various things that are there at the public. I this curve, again, that I did, I received that curve from Upstate. They update these curves for us as it goes on, and I shared that on social media last night. I thought so that people can kind of see what we're asking and why this will impact. Even if they're wrong a little bit, we know if we do better social distancing, we're going to do better with the virus. And we haven't been doing better last week compared to the week before. So let's turn it around. I'm pleading with you. And the only way we're going to do this is the public's got to buy in. That's why we're bringing attention to all of this the way we are.
Besides standing up there and begging people to stay home and not go to the parks or not go shopping on the days that they're not born, what is the punishment if you see people gathering in a place that they shouldn't be?
Yeah, there's two punishments. The governor, we have an executive order that on social distancing policy, and the governor, I believe, today might have raised the fine on social distancing. So you potentially could get a fine or a misdemeanor. Is that the best use of our law enforcement resources? No, it's a horrible use. But at some point, that's a reality if people are going to continue to abuse and not respond. So the good news is most people are doing well with this related to egregiously getting together. The bad news is what I think has happened when you look at our grades with the cell phone data. I think people have gotten a little bit more comfortable going outside their home. They're bored. It's tough. They need to get out of the house. Okay, I'm going to go, and one day I'm going to go shopping here. The next day I'm going to go to Home Depot. The next day I'm going to go there. I think that's what's happening more or less, is that people are more comfortable going out multiple times a week to get what they need. We would rather see people go out one time a week, but if not, pick these days, and just everybody follows this, we should spread out that density that we've seen.
Has any punishment been imposed yet to any individual?
I don't know. I would have to. I'm so busy each day. I don't follow what the sheriff's doing. They're getting calls. They've gotten guidance from the DA. At some point, to have credibility on the matter, if people continue to not listen, you got to do something, right? So I think the sheriff probably needs to could probably answer that question better than I could. But you don't have social distancing fines at the state and misdemeanors here. And if you see the same person 5, 10 times breaking the same law, well, at some point you just lose all credibility if you don't enforce it.
But if you stand up here and beg day after day, why aren't police officers going out and just throwing these out one day to people and finally giving them the message?
Maybe they will. Yeah. Yep.
I'll change my question because I know you picked up on me,
Yes.
wording something differently.
Yes. Prosecutor Donovan, what can I say next?
13 new cases today. You may not have the numbers in front of you, but when was the last time it was that low of a increase? Because that's
I think I think it's got to be 8 or 9 days. Last week was all in the 20s. It's probably, I would say, this is the first time we've had back-to-back 15, 13 numbers in that range in a while. And so people could say, wow, that's good. Yeah, it is good, but how do we keep going in the right direction? Let's do this. We'll get this done with a lot faster and get back to life.
You mentioned all the angry emails you got. Anybody from a credible golf course that isn't happy with this?
That's a good one. I know many of the golfing community very well. My brother Tom is infamous with his golfing prowess, and he's on a board of a director of a club. And so I knew the slack I would get from this decision, okay? And I get the mental health argument that's being made, and it's good physical exercise that's being made. But I'm asking our golfers to put this in this perspective. We are fighting a virus that last week killed 4 people. We have 17 people fighting for their life. If you are a son or a daughter of someone in the hospital right now, you probably can't even go see your parent. If you have a loved one in another part of this country right now that's going through the same process, you can't even go visit them and say goodbye. We're asking kids not to go on play dates. So why do the adults get to go on play dates? So all I'm saying at this point is we talk about shared sacrifice and putting this into perspective for a moment in time. I'm asking this moment in time to be a couple weeks. And we reevaluate every executive order every 5 days. If something changes, we can always pivot, and I've always said we will pivot. But this is bigger than a recreational activity. People are dying, and people are getting very sick, and we have business owners who can't operate businesses because they've been deemed non-essential, and we have many people, quite frankly, some of the golfing demand wouldn't be there if people are all working. So I think overall, I just ask, this is bigger than all of us right now. We all need to sacrifice a little bit, whether it's changing your shopping patterns, whether it's waiting 2 weeks to hit the links and work on your short game. I'm just begging you to understand that this is bigger than all of us.
According to the president's task force, New York State this week is projected to reach its peak for deaths and hospital resource use. Where are we as a county in that? Are we far behind from New York City, or where are we?
I think they're, so look I hope we've reached our peak on deaths. I don't know the answer to that. I know 17 people in ICU is not good. So I know that there's people that fastly become hospitalized in this. They're okay for a day or two, and then they're moving into the hospital. So I think hospitalizations and ICU numbers will probably stay in that range until we flatten the curve. I think we have an opportunity with our active cases to really get that curve going in the right direction. And that's why we're asking and doing what we're doing now. If we get that going in the right direction, we can start really making the argument for getting everything restarted. And we are desperate to do that. My team in county government has been working over 45 straight days on this. We are desperate to deal with something other than COVID-19. I am desperate to start looking at our economic recovery and the next layer of tough decisions. We're desperate to go pave roads, to do other things. We can't get to normal without some short-term pain, and that's why I'm asking everybody to buy in, help me.
Brian, at the risk of repeating a question, a lot of those projection curves actually show peak, like, May, June, July.
Yeah.
So what are we going to know in 2 weeks that'll give you some comfort that we're on the right track? Is it just the cell phone data?
Yeah, you'll have different tracking data on social distancing, and you'll have and that will reflect, at least in the second week, testing demand. Testing demand has been pretty on average. We know the new cases, so if we can get the testing demand down, that shows people are less symptomatic, and the illness in the community is starting to go down. It's not just COVID-19 by social distancing that it helps with, it's every single virus. So by social distancing, people aren't getting the stomach bug, they're not getting any other flu like viruses, they're not getting common colds if they're staying in their own domains. So overall, the health will be better, and we'll be able to know. If we're averaging 75 tests a day in 2 weeks, Tim, our curve is going to flatten out. There's no question about it. The math will 7.5% of those numbers will show you what your new cases are, and then we'll be having more and more recoveries. Once we hit that, where the recoveries are more every day than the new cases, that's when I think this community is going to really have a strong argument to make about looking at what's non-essential today, can that be essential, and how do we get things going. And I think this will help us get to 50%, what we're asking the community to do.
You touched on it a little bit, but can you explain what data you're looking at, what the cell phone data shows you that you're hoping to see change?
Yeah, it shows you activity, right? And it shows you thermal mapping, shows you where people were at a point in time. And so when you look at, when the whole goal is to de-densify, and you see pockets of density, that's against what the goal is, right? That's how the virus spreads. But what we look at is when we say data, we're looking at our own data too, and what very closely monitoring calls to the triage line. What correlations does that have? What are your ratios then to test sites that are tests at our test sites? What are we seeing at all the hospitals? What curve are the demands there? So we're looking at all of our own data. In addition, we don't have great social distancing data, so we rely on these other independent sources and upstates and other hospitals' algorithms that they do. Certainly, we think if we get to that yellow curve that we talked about, that yellow curve is pretty much, you might have some new cases every once in a while, but you got more recoveries. It's a flat curve. That's what South Korea is now, and Hong Kong, and life's going on over in South Korea and Hong Kong right now.
Are you aware of any hospitalized critical cases that have gone non-critical or even discharged?
Yeah, we've had a couple ICU cases where we've gotten them out of ICU. The females do better than the males.
Nobody discharged of those ICU changes? They discharged or just moved to regular care?
Andrew, I would have to, that's such a moving target. I know that we've had people move out of ICU, and I'm assuming some of them have gotten out of the hospital. But certainly, the 4 out of our 5 deaths are males. Any questions? Okay. Anything else? Patrick Penfield tested negative. He's out. Our buddy, Pat, good to have you back. Andrew, that's some good news.
We'll hear from him on News Channel
All right.
9 tonight.
Yeah.